My name is Dr. Tim Lineberry, and I'm a psychiatrist and medical director of the Mayo Clinic Psychiatric Hospital in Rochester, Minnesota. In the September 2012 issue of Mayo Clinic Proceedings, my co-author, Dr. Stephen O'Connor from the University of Washington in Seattle, and I have written a review article. The article, Suicide in the United States Army, describing the latest information and a background and context for suicide in the United States Army. As you may be aware, suicide in the Army and in the military has been a recent significant public health concern, and rates of suicide have risen since the beginning of combat operations. As you may also know, suicides have actually outpaced combat deaths in the past year. There's been great public concern about suicide in the United States Army, but there's been very little understanding of what are the causes and factors associated with the increased rates of suicide in the Army. In this review article, we will provide a background about suicide in the military and protective factors and previous suicide rates, along with integrating information about the effects of combat, the latest research related to those groups at risk, and what data we have from surveillance overall from an epidemiologic standpoint, and looking at clinical visits and encounters. As an example, psychiatric hospitalizations now are the most common reason for hospitalization in the United States Army. We'll also provide some clinical things that you can do based on research evidence. We'll talk about things that make a difference in terms of assessment of post-traumatic stress disorder and depression, and the potential use of sleep as a symptom to help you get more information related to suicide risk. We'll also talk about issues with opioid prescribing and those with psychiatric illness and things that you can do from a screening and guideline standpoint. We'll also talk about issues related to access to lethal means and what you can do in the event of someone who is having thoughts of suicide or depressive symptoms or substance misuse in an active duty soldier or veteran related to decreasing their access to lethal means. We hope that you'll find the article helpful in providing a background and a context both for an understanding of an important public health problem as well as some things that you can do clinically in your practice. Regardless of where you practice, whether it be with active duty soldiers currently in a military setting, in a Veterans Healthcare Administration facility, or in private practice, based on the nature of our conflicts in Iraq and Afghanistan, we expect that you'll see individuals who have served in the military who have potential risk of suicide or other psychiatric conditions that you could benefit from getting more information about. So our article again is Suicide in the United States Army, and it's in the September 2012 issue of Mayo Clinic Proceedings. Thank you.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.